we've now got new dementia-friendly signages, including dementia clock, and a new mobility assessment tool to help our patients feel safer and staff feel more confident.
The most significant change with my daily work is the fact that because the signage is there, for the patients who are able to read it, they feel more at ease. They're a bit calmer because they have confirmation of where they are. If they forget it, as is the case with some of our patients, they can simply look up, see the sign, and they're at ease. So they're able to communicate more effectively, and we're able to communicate, or I'm able to communicate with them more effectively.
So because of the demographic of patients we have on the board, they're elderly, some of them come in with confusion. They've been less frequently asking the staff where they are and what time of day it is. Even if patients, you don't speak the same language, if they're trying to say, or trying to communicate with you, you can always tell them where you are in Norfolk Park Hospital. You can point to the sign because most of them know Norfolk Park Hospital. This has been the hospital that they've probably been using for years. So it reassures them that they're in a familiar environment.
Well, I think it's certainly helped to reduce the confusion about when they wake up and think, where am I? I think it's a brilliant idea because one of the things you worry about when your loved one goes to hospital is the confusion that they're going to experience, especially when they're at a certain age. So I'm sure it certainly would go towards reducing that somewhat, at least if you can say, look, this is where you are straight away.
Not so many patients with dementia, cognition concerns. Do the assessment for the patient. We put them on the mobility board, what their mobility status look like, and it's helpful for the rest of staff so they know, is this patient doing transfers only or mobilizing, and which equipment is needed.
The quality improvement project going on the ward for safe mobility. This is to give confidence and support to staff to be able to mobilize our patients, get them moving without waiting for the therapist, especially if the patient has not come in with a fall or a fracture. The project is still ongoing. Some staff have been trained, but there's still more staff to be trained as well.